Today there are no new cases of Covid-19 to report in managed isolation or quarantine facilities in New Zealand. Likewise, it's now been 73 days since the last case of Covid-19 was acquired locally from an unknown source. So our total number of cases remains at 1,194, which we will report again to the World Health Organization today. There are no new recovered cases, so we still have 25 active cases in New Zealand, and none of those cases requires hospital-level care. Just a few words on implementing our Covid-19 testing strategy. There are three key groups that are being tested. The first of these, of course, is all our returnees who are tested at day 3 and day 12, or around then, during their 14-day isolation period in our managed isolation facilities, or at any time if they are symptomatic. So the mandatory 14 days in managed isolation is again the mainstay of our protection at the border, and the addition of the testing twice during the visit or during the stay obviously provides that extra security. The second testing group is, of course, our testing out in the community of people with respiratory symptoms. And the main group that is being tested there are those who are judged at higher risk. For example, they may have had contact with someone who works at the border or who has returned from overseas recently. But there is also testing of other people as well across the country with symptoms, and this is a key part of our community-based surveillance. And the third group of people being tested are our people who are working in managed isolation and quarantine and or at the border. And last week we commenced the testing of those people, asymptomatic. Again, this is part of our surveillance testing, and we started with the group who are working in managed isolation and quarantine facilities, as they are have more exposure over a longer period to people returning from overseas, so are at a slightly higher risk. And this week we will be further rolling that out to include staff working at the border at our airports in particular. So last week, for example, here in Wellington, there were 34 staff working at one of the managed isolation quarantine facilities who were tested, and likewise staff were tested in both Auckland and Christchurch. And finally, our testing yesterday, being a Sunday, somewhat lower testing numbers, 1,043 processed by the laboratories, and we will expect that to increase this week as those three groups of people are tested. The total number of tests completed to date, for your information, is 429,643. Thank you.
This morning the Director General and I visited one of our managed isolation facilities, the Grand Mercure in Wellington. I do want to say at this point how impressed both of us were by the commitment of the staff at these facilities. That commitment is typical of what is happening around the rest of the country. For obvious reasons around health, safety and security, we didn't talk directly to the returnees at the Grand Mercure, but we do recognise the efforts of the tens of thousands of New Zealanders who have returned home so far, and the efforts that they have been going to do the right thing by all of us. So today I want to reinforce that the government is committed to doing the right thing by them. There are a range of supports available to people during their time in managed isolation and quarantine. They have health and wellbeing assessments on arrival at the facilities. That includes questions about mental health and wellbeing. They're also provided with information on any mental health issues, substance use, and wellbeing resources that can include online therapeutic tools. They receive a 19-page booklet that provides essential information such as what they can expect from the facility, the provision of food, medical care and welfare support. Within the facilities, people are able to access mental health support, managed physical activity and access to primary health care during the course of their stay. We're aware that growing numbers of people are returning to New Zealand, and that there are associated pressures with that may arise within the facilities. We also recognise that getting home in itself can be very stressful for people and for their families. So we'll continue to supply the support and adapt the sort of support that people need to meet their wellbeing and health needs. It's important that we show compassion towards those New Zealanders who are returning and who are using these facilities, and acknowledge that they are playing their part in keeping our team of 5 million COVID-19 free. A brief word about staffing at the facilities. The staffing scales up and down at the facilities as required, depending on the number of guests who are staying at the facility and where they are in the duration of their stay. So, for instance, there are normally higher numbers of health staff on arrival day and on checkout dates, as well as higher numbers of health staff when there is swabbing taking place. There is a nurse at every facility every day. Health staff are well trained to follow the standard operating procedures. Staffing levels are constantly monitored by each region where the managed isolation and quarantine facilities are located, to ensure that appropriate care is in place for all of the people all of the time. So I want to finish my introductory remarks today with a request again for all New Zealanders when it comes to keeping us all safe from COVID-19, and that is to ask every one of us to keep a digital diary of our whereabouts using the COVID-19 digital tracer. It's free, it is secure, it is your information, and it's going to be a key tool for us if we ever need to reach the point where we have to do more widespread contact tracing. So, to update the numbers, the contact tracer has 594,000 registrations. There are now 77,564 QR code posters around the country where people can check into where they have been, and the number of poster scans so far is 1,409,277.